Thank you, Andrew. This is Leah Pollack. I'm a partner in our Washington, D.C. office and a member of our public sector practice. And I've been leading the work across North America on reopen. So how are we seeing for our public sector clients, particularly at the state or provincial level, as well as at the local, working with a lot of cities on developing their reopen plans, and also now starting to think about resurgence, that exact topic of how are we actually going to prepare for a second wave. So what we wanted to share, at a high level is there have been, if you look across Canada and the U.S., there have been, a ton of different approaches to reopen. You look at the maps we show here, it's really a patchwork. Even if and this is just showing the dates of reopen, but if you actually get into the plans themselves, what we've seen is a huge amount of variability as well, and we'll talk about kind of some more examples, whether you're looking at North America, but also if you're looking internationally. So in terms of U.S. and Canada, something that we've seen is that, it's a lot of, a lot of states and provinces are putting out multi-phase plans. Those range from, sometimes we're seeing, just phase 1 announced to up to 7 phases announced. The other thing with these reopen plans and with the phased plans, there's a lot of either kind of general guidance or very specific guidance around safeguards. That's something that Lee mentioned early on. It's a key piece of reopening, is how are you actually adapting behavior? What are you doing for workplaces to reopen safely? What are you doing for restaurants, for retail, otherwise? And so a lot of, about a third of, at least in the U.S., about a third of states where if they haven't announced phased reopening, they have gotten very specific about the health and safety practices. But the other thing we've noticed is that there are a lot of high-risk activities. You think about schools, K-12 schools, even higher ed. The specifics around those reopenings, those are really getting, the details of those are getting developed now. And so we're kind of waiting to see of some of those high-risk activities, many of which are being, will reopen more in a later phase, how those will be established, the consistency across those plans as well. And then the other thing we wanted to mention is we're seeing a lot, while some states and provinces are being quite consistent in terms of reopening, taking the same approach to reopening across the entire, area, others are taking a sub-regional or letting some level of sub-regional variation occur. And so again, this is contributing to what we're thinking of in terms of the patchwork. If you turn to the next page, the other thing is even looking beyond North America, what we wanted to share is the approach to reopen. There really is no one playbook. If you look, took a couple of country examples just to share kind of what's the theory of the case or what are some of the big archetypes for planning for reopen. China, one of the first countries to really start this reopening process, they took an approach was about thinking of sectors that were most critical to the economy. Patrick shared some data for Canada on that. So looking at the criticality of the sector as well as the risk of transmission. This is an approach we're seeing, New York, California, Ontario are a lot of states and provinces that are taking this approach of really looking at the risk of transmission of the sector and then phase by phase planning out reopening based on both the economic importance as well as the risk of transmission of COVID. The next is the example of Denmark, which I know as a parent, a lot of parents are looking at Denmark as an example of they led with opening childcare in schools first. And so they have said, we know that this enabler of childcare and schools is so critical to allowing others to get back to work. We're actually going to open that in phase 1, and then in later phases open other sectors of the economy. Germany is a different example of they actually were looking at jobs that were potentially vulnerable, as well as sectors that they were worried about, with the reopening, the overall economic impact of those closings. So you saw a lot of small footprint retail and other stores opening in the first phase. And that's, Switzerland's a little bit of a variation, but also where this is the ability to safeguard kind of sectors where limited customer interaction, they open those up first. And then finally, we want to share the New Zealand example where New Zealand, their model is different from the others that we share, where they said, we're actually going to target elimination. We're going to go for 0, and they've been very successful in terms of saying, we actually want no new cases. And so they took an approach that was very closely linked to data and and tracking the data to allow them to progress face-to-face with the goal of having no new cases. If you turn to the next slide, we wanted to share an example of kind of, if you look at that first row, that example from China that we're seeing many states and provinces across Canada and the US take of kind of both what's the economic impact, what's the criticality of the sector, as well as what's our ability to safeguard, or what's really the risk of transmission. So we looked across a number of sectors and did that mapping. And this is something that, we know a lot of public sector leaders are doing at the state and local level to say kind of what are the sectors that are easier to safeguard as well as those that are harder to safeguard. How would you map them in terms of contribution to GDP as well as contribution to employment? And so what we wanted to highlight here that we thought was really interesting when we did this analysis is that those that are easier to safeguard, pretty significant contribution to overall GDP in terms of Canadian GDP, with about a third of sectors in kind of easier to safeguard. But if you look at employment, the share of employment is lower, whereas those, if you go to the other end of the chart, the sectors and activities that are harder to safeguard, while not in terms of GDP or not, don't contribute as much, in terms of the importance to employment, are actually quite significant. And so really thinking about, and this is the balancing both, as Andrew said in the opening, the lives and livelihood piece of reopening, and really making, how do you balance both the ability to safeguard with the contribution to GDP and the overall contribution in terms of employment. So on the next slide, we've also shared kind of just an example of when we're talking about safeguards and we're talking about protocols, this is really a key piece of reopening plans, is what are you putting in place across the different sectors and activities in terms of prevention. So this is everything from the physical distancing to the hygiene, contactless payment, how are employees actually getting to the workplace, ongoing tracking and reporting. So what are the laws around temperature checks? What can you do for employees to do symptom control, to report cases, and then this awareness and enforcement. This is a huge area that we're seeing as the conversation shifts from how to reopen to more of how do we stay open. Communications is fundamental and is at the core of boosting consumer confidence, of really making people aware of where you are, what's open, and how we might progress to the next phase. And then also compliance. How are we actually ensuring that people are, with reopen, complying with some of these protocols that are established? And so just before we close out this section, wanted to share something that Lee mentioned. This is on the next page, that Lee mentioned in her section about how important it is to monitor the data. And so here we have 3 slides that share a tool that we've developed called the C7, or the COVID status tool. It's C7 because of the 7 domains of data that we're monitoring. Everything from the foundational public health, what are you doing around testing, contact tracing, the actual level of compliance, societal compliance, your health system capacity, the level of industry safeguarding. We just talked about some of the protocols that we're seeing established, protection of vulnerable populations. This has been actually fundamental to resurgence. If you look at Singapore, the vulnerable population of migrant workers is an area where they saw huge case growth. And so really monitoring and how are you protecting vulnerable populations, overall economic health. Patrick talked about some of the metrics to track there. And then 7 in terms of your epidemiological reality. And on the next slide, I'll just share about when we're talking about the epidemiological reality, this is where we're looking at the prevalence, disease prevalence, rate of positive tests, new case growth, and mortality rate. So this is an example. This is illustrative data from the U.S. And what we wanted to share here is while there's a composite score for the epidemiological reality by, in this example, by state, what's actually interesting is to look at the data for each of the metrics at the state level, because we see a lot of variation across states on the different metrics. And even beneath this, if you go to the next slide and talk about this is an example of a specific state, is that looking at the data all the way down at the county level. And here, we give our, public sector leaders the tools to look at. Here, those flags are hotspots. to say kind of what is happening at the local level in terms of particularly looking at case growth and prevalence, so that, and this is the whole notion of in terms of staying open, how are you actually monitoring the disease, and also how are you complying with different guidance that's being put out around metrics to track. So just in the interest of time, I'll wrap there and hand it back over to you, Andrew.
And then, well, we'll just check if we got any questions, otherwise we'll move on. I mean, one thing I would want to just amplify in your last two slides is that I think we're seeing as a theme everywhere is the importance of really granular data as we move into this restart phase. I mean, we believe, perhaps to state the obvious, that this recovery will be incredibly uneven. It'll be uneven by type of the segment of the population, and your point on vulnerable populations. It'll be uneven by where it spreads and resurges geographically. It'll be uneven by sector in terms of where different parts of the economy come back and not, and the importance of getting a close to real-time pulse on that data with real, and maybe that needs to be sourced partly from government, partly from business. You know, we are finding that to be a really key ingredient to some form of a successful return to work, to access this information more real time.